Pharmacology. I think you are pretty familiar with pharmacy. Pharmacy, basically talking about the medication or drug. So pharmacology, we're still talking about the medication or drugs, but it's different. We're talking about the pharmacy. Pharmacy is the handle the medication or drugs to the patient. Already we used these words before, means we study. We study the medication, we study the drugs. So that's basically in this class. Generally, this general information. This general information. We only have 5 class. We couldn't talking about too detail. We just got some basic information about the medication and the drug. I chose some like drugs specially working for some special systems, but still just the general information. We are not go to too deep or too detail. So we say talking about pharmacology. We're talking about study the drugs or medication. It's working together with the living organism. So in here, basically, we're talking about humans. So that's the main way we start in this class. So there are 2 aspects. Yeah, it's 2 aspects. We talk about this. Like when the drugs go to inside human bodies, how it working for the humans. And another aspect is how there be absorptions, how they distributions, and how they exclusions, like finally release from the body. So that's the general information we will talking about the drugs. And clinical pharmacology. So that's when we talking about how safety way we use the medication or drugs. So that's basically we will learn in this class. And the drugs or medication can come from different aspects. So some medication is directly coming from minerals, like a natural minerals. We can directly use it. Some medication, they may coming from animals. We use animals as part of our medication. The typical medication coming from animals, like insulin. Yeah, insulin is mostly coming from pig. Yeah. So pig's insulin pretty similar like human beings insulin. So certainly we couldn't take insulin from human beings, but if patient have like illness, like diabetes, they need insulin. So where the insulin coming from? Coming from animals. And also some other hormones may also coming from animals. Thus, that be easy way to get that kind of medication. And also some medication coming from plants. coming from plants. We directly take some ingredients coming from plants and some drugs coming from we make it. And even some medication or drugs coming from microorganisms. We're talking about the penicillin before. Yeah, we're talking about penicillin before. It's occasionally be found when the doctor culture for some bacteria, but occasionally found it's some penicillin. Yeah, it's coming from the microorganism. And also, we also can coming from energy kind of engineer. Yeah, like right now, originally insulin is coming from animals. Right now, we can coming from energy kind of engineer and producing insulin and other hormones also talking about. So that's mainly, the big part is omega. So medication or drugs can coming from different sources. Then we go to some special words here. We're talking about the drugs relationship with the organism. Mainly here we're talking about the human. We say we have two aspects. One aspect, when the drugs or medication go to inside of our body, like how it be absorbed, how it be distribution, how it metabolism, and how it be execution. Like how drugs moving inside of body. So the drugs moving inside the body, we have a special word. So that's just means how drugs moving inside the body. The simpler words we use PK. And we say when drugs or medication go to inside of the body, we'll talk about some detail later. We go to another page first. Another aspect, when the drug go to inside the body, how it can working for the body cells. Special kind of medication or drugs, they will working for special kind of cells or tissues. That kind of tissues or cells means the target cell. So that means how the medication working. So that aspect, we call it PD. So that's when we talking about pharmacology, we talking about two aspects. One is how the drug metabolized inside the body. Second aspect, how the drugs working for the target cell. So that's mainly two things we need to discuss. So we still go to our review first to see some general information. Then we come back.
Pharmacology. What is pharmacology? Pharmacology is a branch of medicine and pharmaceutical sciences, which is concerned with the study of drug or medication action, where a drug can be broadly or narrowly defined as any man-made, natural, or endogenous, from within the body, molecule, which exerts a biochemical or physiological effect on the cell, tissue, organ, or organism. More specifically, it is the study of the interactions that occur between a living organism and chemicals that affect normal or abnormal biochemical function. If substances have medicinal properties, they are considered pharmaceuticals. Clinical pharmacology is the science of drugs in humans and their optimal clinical use in patients. It is underpinned by the basic science of pharmacology, with an added focus on the application of pharmacological principles and quantitative methods in the real human patient's population. In addition, the application of genetic, biochemical, or virotherapeutic techniques has led to a clear appreciation of the mechanisms involved in drug action. The two main areas of pharmacology are pharmacodynamics and pharmacokinetics. Pharmacodynamics studies the effects of a drug on biological systems, and pharmacokinetics studies the effects of biological systems on a drug. In broad terms, pharmacodynamics discusses the chemicals with biological receptors, and pharmacokinetics discusses the absorption, distribution, metabolism, and excretion, ADME, of chemicals from the biological systems. Pharmacology is not synonymous with pharmacy, and the two terms are frequently confused. Pharmacology, a biomedical science, deals with the research, discovery, and characterization of chemicals which show biological effects, and the elucidation of cellular and organismal function in relation to these chemicals. In contrast, pharmacy, a health services profession, is concerned with the application of the principles learned from pharmacology in its clinical settings, whether it be in a dispensing or clinical care role. In either field, the primary contrast between the two is their distinctions between direct patient care, pharmacy practice, and the science-oriented research field, driven by pharmacology. Pharmacokinetics, from ancient Greek pharmakon, drug, and kinetikos, moving, putting in motion, sometimes abbreviated as PK, is a branch of pharmacology dedicated to determine the fate of substances administered to a living organism. It attempts to analyze chemical metabolism, and to discover the fate of a chemical from the moment that it is administered up to the point at which it is completely eliminated from the body. Pharmacokinetics is the study of how an organism affects a drug, whereas pharmacodynamics, PD, is the study of how the drug affects the organism. Both together influence dosing, benefit, and adverse effects, as seen in PK/PD models. Pharmacokinetics describes how the body affects a specific chemical after administration through the mechanisms of absorption and distribution, as well as the metabolic changes of the substance in the body, such as by metabolic enzymes such as cytochrome P450 or glucuronidyltransferase enzymes, and the effects and routes of excretion of the metabolites of the drug. Pharmacokinetic properties of chemicals are affected by the route of administration and the dose of administered drug. These may affect the absorption rate. Pharmacokinetics including 5 parts. Biotransport or liberation, the process of release of a drug from the pharmaceutical formulation and pass through the membrane. There are a few different ways when drug across cell membrane, such as simple diffusion, filtration which will not use energy and no special protein channels need, and also facilitated diffusion, active transport which need protein channels and maybe energy's help. There is another way drug across cell's membrane, it is cell endocytosis. Absorption, the process of a substance entering the blood circulation. It is depending the route the drug enters the organism, and its bioavailability, which is the rate and amount of drug that is absorbed from a given dosage form, and reaches the systemic circulation. Distribution, the dispersion or dissemination of substances throughout the fluids and tissues of the body. Metabolism, or biotransformation, or inactivation, the recognition by the organism that a foreign substance is present and the irreversible transformation of parent compounds into daughter metabolites. Excretion, the removal of the substances from the body. In rare cases, some drugs irreversibly accumulate in body tissue. When talking about excretion, it is usually using half-life of a drug. What is the half-life of a drug? A medication's biological half-life refers simply to how long it takes for half of the dose to be metabolized and eliminated from the bloodstream. Or, put another way, the half-life of a drug is the time it takes for it to be reduced by half. Pharmacodynamics. Pharmacodynamics, PD, is the study of the biochemical and physiologic effects of drugs, especially pharmaceutical drugs. The effects can include those manifested within animals, including humans, microorganisms, or combinations of organisms, for example, infection. Pharmacodynamics and pharmacokinetics are the main branches of pharmacology, being itself a topic of biology interested in the study of the interactions between both endogenous and exogenous chemical substances with living organisms. In particular, pharmacodynamics is the study of how a drug affects an organism, whereas pharmacokinetics is the study of how the organism affects the drug. Both together influence dosing, benefit, and adverse effects. Pharmacodynamics is sometimes abbreviated as PD and pharmacokinetics as PK, especially in combined reference, for example, when speaking of PK/PD models. Pharmacodynamics places particular emphasis on dose-response relationships, that is, the relationships between drug concentration and effect. An adverse effect is an undesired harmful effect resulting from a medication or other intervention, such as surgery. An adverse effect may be termed as side effect, when judged to be secondary to a main or therapeutic effect. If it results from an unsuitable or incorrect dosage or procedure, this is called a medical error and not a complication. Adverse effects are sometimes referred to as iatrogenic, because they are generated by a physician or treatment. Some adverse effects occur only when starting, increasing, or discontinuing a treatment. The harmful outcome is usually indicated by some results such as morbidity, mortality, alteration in body weight, levels of enzymes, loss of function, or as a pathological change detected at the macroscopic or physiological level. It may also be indicated by symptoms reported by a patient. Adverse effects may cause a reversible or irreversible change, including an increase or decrease in the susceptibility of the individual to other chemicals, foods, or procedures, such as drug interactions. In terms of drugs, adverse events may be defined as any untoward medical occurrence in a patient or clinical investigation subject administered a pharmaceutical product, and which does not necessarily have to have a causal relationship with this treatment. In clinical trials, a distinction is made between an adverse event and a serious adverse event. Generally, any event which causes death, permanent damage, birth defects, or requires hospitalization is considered a serious adverse event. The results of trials are often included in the labeling of the medication to provide information both for patients and the prescribing physicians. The term life-threatening in the context of a serious adverse event refers to an event in which the patient was at risk of death at the time of the event. It does not refer to an event which hypothetically might have caused death if it were more severe. This is the basic knowledge of pharmacology.
Okay, so let's come back. So that's some general information about the drug effect of the body. So that's talking about one by one here. So when we're talking about pharmacology, we say we're mainly talking about two aspects. One aspect is the drug go to inside of the body and how it passing through of our body. That's the way the passing through. So they passing through for the cell's membrane first. And then we're talking about drugs absorptions and drug distributions and drug metabolism and finally execution. So that's 5 aspects together. That's PK. That's PK. We're talking about one by one. The first part, we're talking about the drugs mainly passing through the cell's membrane. We know any kind of, including medication, including the chemicals, or even including the nutrition, the food, it must be passing through the cell membrane first. Then they can absorption. We're talking about the structure of the membranes, cells membrane. Biological means cells membrane. The human body cells membrane, yeah, including some animals, certainly. They have special kind of structures. So these special kind of structure, so when we talk about the cells, the body cells, we say it's covered by the membranes, covered by the membrane. And inside the cells, we have nucleus. And we also have some liquid part, cytoplasma. And the cell membrane we also can call plasma membrane. And we have some microorganelles in the liquid part, cytoplasma part. So now we're especially talking about the cells membrane, like we take small pieces from there, then we make large here. So that's basically the cells membrane. Basically the cells membrane. The together part, we call it plasma membrane. Plasma membrane. So the plasma membrane, we can see in the plasma membrane, it looks like they have some bigger things here and look like a hollow inside. So this kind of structure, basically we call it protein channel. Yeah, protein channel. So this kind of protein channel can allow some special things passing through it. And also you can see that the whole membrane here, they also can allow something passing through. So we have different ways the material passing through. So this membrane, usually we call it semi-permeable membrane. Means it can allow some things passing through freely. So like some water can pass through, glucose can pass through. So different materials passing through cell's membrane way is different. Then we're talking about some special way to passing through the membrane, especially for different kind of medication or drugs. I think some students be the some physiology class before, physiology class. We will have in the next semester also, if you are not in that class before. So in our physiology class, we talking about the normal function of the body. Normal function of the body, like any materials passing through the cell's membranes, they have two big different ways. One way we call it passive way. One way is active way. When we talking about passive way, that means during this way, like the material can directly passing through. It's not need energy. Inside of body energy we directly can use is ATP. But this kind of way is passing through. They are not necessary to use ATP. So that's the same way some medication still can directly passing through. Thus, we still call it a passive kind of transmission way. Still not necessary to use energy or ATP. So these, we still have two ways, even passive way. One way we call it a simple diffusion. Simple diffusion, basically, the medication or drugs moving from high concentrated part to low concentrated part. And this kind of drugs usually is liquid, means fat, soluble kind of drugs. Why we say it's usually is liquid, soluble kind of drugs? Because our cell membrane basically is the liquid kind of in there. So liquid and soluble kind of drugs is easily passing through from high concentrated part just directly through the membrane to the low concentrated part. So that's similar like this one. We're talking about fat soluble kind of material is directly passing through. So that's one passive way, one passive kind of transform. And also we have another passive kind of transform. We name it filtration. So still we still not necessarily use energy, but that kind of drug is the water soluble kind of drug. So water soluble kind of drug, they still easily passing through the membrane. Still not necessary to use energy. They are follow the water and then passing through the membrane. So that's the first way we're talking about the drugs passing through the membrane. Is passive way. So passive way, we are not use energy. Then we're talking about some special ways. Yes, some special ways. Special way drug passing through the memories. We have one way, we call it facilitate way. Facilitate diffusion. So facilitated diffusion, pretty similar we talking about the passive way before, and still belong to passive way after. But we put in here with a specialized kind of transmission way in here because they need protein channels or protein to carry it to passing through. Even they not necessarily use energy, so they still belong to passing way, but they need protein to help. The first we talk about the simple diffusion. No energy, no protein needed. That way we call simple diffusion. If they don't need energy, but they need protein help, we name it facilitate diffusion. So don't confuse it here. So that they don't need energy, but they need protein. They still coming from high concentrated part to low concentrated part. The difference, J's use protein. The second special way to transmission, we special name it active transport. Active kind of transport means they coming from low concentrated part to high concentrated part. If I use high concentrated part or low concentrated part, you may let be confusing. But you can thinking about like lot of people in there's a wall in here. Yeah, for example, there's a wall in here, and a lot of people in one side of wall. And in the wall part, they have some small space here, like a small door in here or window in here. But just a couple people in this side. So certainly people pretty like coming this side to this side, or maybe easily coming from this side to this side. So that's we're talking about why is basically that's positive way, why is simple diffusion, why is facility kind of diffusion. Simple diffusion is like a people passing through this wall, like through a small window. And the facilitated kind of diffusion, people passing through this wall by the door, like the door open to allow people easily to pass through. So that's pretty similar. We're talking about the drug or medication, they passing through the cell's memory. And the active kind of transmissions, like nice people in this part, but they try to go to this part. Another example for active kind of transmission, you can thinking about the water. We know the water is pretty easily flow down, but it's hard coming from lower part to higher part. You need a pump. Yeah, you need a pump. So a pump can make it go up. So that's the way we need to use energy. inside the body, the antigen. We talk about ATP. So that's the way we talking about active transport. Active transport against the concentration. Against concentration. And need use antigen. Just like we try to alleviate the water from the lower part go to the higher part. So that's the second special way transport. The third special way transport, endocytosis, means eating. Just like we talking about some special cells, they can have function of eating functions, and then they just same time they moving the materials from one side to another side. So we're still talking about like the cells in here, and some drugs close to the cell's membrane, and the cells can cover it gradually, and then finally eat it. So by this way, the medication or drug through the cell's membrane. So that's basically we're talking about bile transport. Bile transport means the drugs passing through the cell membrane. They have different ways. By the structure of the bile membranes and by different kind of drugs, they possible positive kind of transmission. Not necessary to use antigen, not necessary to use protein. They just from the high concentrated part to low concentrated part. And if the medication or drugs is a liquid soluble kind of drugs, they by the simple diffusion rate means directly through the membrane, cell membrane. And if the drugs or medication is the water soluble, thus follow the water by the filtration they through the membrane. But if the drugs, sometimes it's pretty bigger, they need a protein to carry or protein channels, but still from high concentrated part go to low concentrated part. We call that way facilitate kind of diffusion. But if we need against the concentrations, we need antigen. Usually still protein in there. Usually still protein in there, protein channel in there, and antigen. That way moving, we call it active kind of transport. Some special kind of medication or drugs, they close to the cells, and then cells can eat it. So that's another special way. So whatever, any kind of medication or drug, they will through totally we have 5 different ways can passing through the cell membrane. So that's the first part, we especially talking about the drug passing through the cell membrane. Any question